There are 9 things that medical offices might be doing wrong when checking your blood pressure, and you're the one that needs to be aware of this because you don't want to be prescribed medication if you absolutely do not need it, because there are consequences and side effects of these medications. So let's get into number 1. Using automatic blood pressure machines, such as a wrist one or one of these, where you simply the skill level required is you just push a button and let the machine do the job. The reason why these have been developed is to make it easy to have staff do the blood pressure. When I went to school, these automatic blood pressure machines didn't really exist. You had to use this, and you had to be able to read that. There is skill involved with this, and very often when you go to a cardiologist, for example, they may use these because they know that this is the way to check blood pressure. If you're on the fence about it, or you just use one of these and the blood pressure seems to be normal, then why even put effort in? But when you properly take blood pressure, you want to be able to use this here and pump it up enough just so that it cuts off blood circulation in the upper arm so that you don't cause undue pain. There's a skill level with deciding what type of cuff you're going to use. And then you have to listen, because you can learn a lot about a patient by listening. Now wait until number 9, because that is going to be the most important in a minute. But you can hear a lot of things about a person's heart that these automatic ones just don't do. So if you really want to know if you have high blood pressure, get your doctor to use an old-fashioned blood pressure cuff. Number 2 is using untrained staff. Because of the automatic blood pressure cuff, you can literally just have a monkey walk into a room, rotate the thing so that it's tight on the arm, and push start. But using untrained staff, or worse, staff that should be trained and should be knowledgeable in how to do it, but they didn't exactly get straight A's in school, they're the ones doing blood pressure, and that is a mistake. Number 3, the office is rushed. And this is no justification, but it does happen. When the doctor has 30 patients in the waiting room waiting, and it's 20 minutes before lunchtime, sometimes the staff wants to get out of there, and doctors are human. They want to go to lunch as well. So very often they will kind of rush people through. They'll walk into the room and they'll just slap that thing on, and they do it in a very fast way. The true definition of high blood pressure is when your blood pressure is high when you are in a rested state. So if you're not relaxed, that's a big mistake. Number 4 is the wrong procedures. Now, I've made many videos about this. At the end of the video, I'll talk about 11 mistakes that you make when you're taking your own blood pressure, and that'll be in a box at the end. But you have to be relaxed. You have to have your feet on the floor. You have to have back support. When you check your blood pressure, your upper arm needs to be at heart level. You need to empty your bladder. You need to have 5-10 minutes to relax before you have the blood pressure taken. You need to not have coffee and not smoke a cigarette right before your blood pressure test. People make this mistake when they're checking their own blood pressure, but because, again, doctors' offices are rushed, they don't often check it in the perfect scenario, so that is why it's bad. But they don't often use the proper procedures and thus get skewed results. Number 5, the wrong size cuff. I have a normal sized arm. And when you look at these blood pressure machines, they often have cutoffs where if you can't wrap the cuff around the arm, look what happens. If someone had a big arm here, and this is not that big, there's many people that are obese that have, or even just weightlifters will have an arm that's too big. If you can't wrap it around, it actually says right there, If you can't wrap this piece to that area, that line, select a larger cuff. Many people, unfortunately, get diagnosed with high blood pressure when the cuff is simply too small for their arm. And because doctor's office may have a staff that's unaware of this, they're rushed, they do it real quickly, and in addition to all the things I mentioned where they don't use proper procedures, then they use a smaller cuff on your arm, of course you have high blood pressure. Number 6 is diagnosing a person after just one reading. Now, I personally know a lot of primary care doctors, and I don't know anyone personally who does this, but I read about this all the time in the comments section when I make videos. Is someone says, my doctor prescribed medication for me after only one test. This is a big mistake. Doctor's offices should be checking your blood pressure, and if it is high, they should check it again, and then they should check it at the end of the visit. And then they should have you check your blood pressure at home, because you might be nervous, you might have white coat syndrome, you might be having anxiety about being at the doctor's office, these types of things. They should have you check your blood pressure for a period of time, maybe a week or two at home. They should instruct you how to check your own blood pressure. They should tell you what blood pressure machine to buy. I'll put a link down below in the description, but you should get an Omron. Those are the best ones for self checking. But they should check your blood pressure multiple times. And if your blood pressure is always high at home, at the doctor's office, when you're rested, under proper protocols, then you do have high blood pressure. And if you're not going to change your diet or your exercise, then that's a good reason and justification for why the doctor should prescribe medication in that case. Number 7, causing pain. This is one of the benefits of using an old-fashioned blood pressure cuff and having skill. When you check blood pressure with just one of these automatic blood pressure machines, the machine will pump the cuff way too hard, excessively hard, and that can cause pain, anxiety, fear, and that can raise your blood pressure. When you use one of these, you're able to listen to the artery and pump it up just enough that it closes the artery, but not so much that it causes pain. In addition to that, if you are at the doctor's office because of an injury or a burn or something that's actually causing pain right at that moment, pain will temporarily increase your blood pressure. So let's say you fell down and hurt your knee, and your knee is in agony, and you're at the doctor's office, and the nurse slaps the blood pressure cuff on real quickly. They're rushed. They're not using good protocols. Your blood pressure's high. Of course it's high. It's because you're in pain. So either you're in pain or the blood pressure cuff is actually causing pain, but pain is a significant reason why people's blood pressure can appear high. Number 8, not recognizing white coat syndrome. I'm not sure why I keep hearing about this, but many people, again in the comments, will say they have white coat syndrome. And what this means is as soon as they get to the doctor's office, their blood pressure goes through the roof and it just raises. But in normal cases at home, their blood pressure is normal. This again is why I just told you that if the doctor really wants to know if you have high blood pressure, he should check it at the office in multiple times, but then also have you check it at home yourself. Because it may be that your blood pressure appears high only because of the anxiety, fear, and nervousness that you have at the doctor's office. That's what's called white coat syndrome. And you don't need medication if the only time your blood pressure is high is at the doctor's office. The 9th and final thing that medical offices just screw up is not listening to the patient. Because of all the things I just mentioned, they're rushed. They'd have untrained staff. The doctor is quick to prescribe medication after just one reading. They don't listen to the patient. It is so important to listen to the patient. Even if you prescribe medication to the patient, you have to listen to what the response is. If a patient, let's say, is diagnosed with high blood pressure, and then they are given medication. But then the next appointment, the patient says, I don't know, doc, ever since I've been taking this medication, just the life has been sucked out of me. I have no energy. I'm tired all the time. When I go from sitting to standing, I get dizzy. I'm not sleeping well. I'm having a lot of symptoms ever since I've been taking this medication. The doctor should listen to that. They need to listen to the patient, because that's a clear sign. What I just mentioned was that the medication is not right for that individual patient. So many doctors' offices, there's so much ego in healthcare. They want to be right. They feel that they call it a God complex, that I'm right and the patient is wrong. But when the patient is clearly having a negative reaction to a drug, that's information. Now, sometimes, listen, doctors make mistakes. It's okay. We are held at a high standard, and people think we never make mistakes, but we do. Sometimes that happens, but we have to listen to the patient so that, if someone were to prescribe penicillin to you and then you just started itching all over and then you couldn't breathe, the doctor would listen to that and say, gee, this person obviously has an allergy to penicillin. We shouldn't give them penicillin anymore. Put that in the chart, and from now on, they need to give you something else. That's called listening to the patient. It isn't that necessarily the doctor made a mistake by prescribing penicillin. He didn't know, and the patient didn't know, that they were allergic. But now, once you've listened to the patient and the patient comes back with a response from the medication, now we know that penicillin is not right for you. The same exact thing happens with blood pressure medication. You go into the doctor, your blood pressure's high. He gives you 2 or 3 medications for your high blood pressure, and now you're getting major symptoms that you didn't have before. Is it possible that that initial reading was wrong? Is it possible that the person actually has white coat syndrome, and maybe now that you're giving them the medication, that it's lowering their blood pressure so much below even what their normal was, that now they're having a problem? This is the most common thing that I see, is a person comes into my office because I'm a doctor of chiropractic, and they maybe fell down and tripped and fell, or they got up and got dizzy and fell down, and now they hurt their elbow, their knee, their back, their neck, that type of thing. They come in and I say, well, why did you fall down? And they'll tell me, oh man, ever since Dr. Story, I've been taking this blood pressure medication, I just don't feel like myself anymore. I feel lethargic. I feel tired all the time. Every time I get up in the morning, I feel dizzy. I feel like I'm going to fall. And sure enough, they fall. Now they're seeing me. And very often I'll explain to them, well, wait a minute, let's have you relax. Check their blood pressure in my office, and it is low. And then I'll tell them, what was your blood pressure at your doctor's office? And they tell me it was super high. It was only one reading. The nurse or the physician assistant or the nurse practitioner took it. They never saw the doctor. And all these things are just a recipe for problems. So the most important thing here is you listen to the patient. That's a big mistake. And I know doctors' offices are busy. There's a lot of stress involved in a doctor's office of processing all these patients, but it has to be done to properly have great healthcare, which is something that we all deserve. If you're looking for a great collagen supplement, these are the ones that I like. These are made from the company called Bioptimizers. This is the company that makes the magnesium supplement that I like. As far as these are concerned, these are both pretty good. I'll tell you what my favorite is. Holy cow, it's this one. It's the salted caramel. You could literally just put this in water and it's delicious, but you can mix this with like an almond milk or water, or put it in a smoothie. If you put it in a smoothie, it's really good, but the chocolate one is really awesome as well. Now, the benefit of this, you can go down, there'll be a link down below in the description so you can read all about it and all the details, but essentially this has 2 different mushrooms in it, which actually helps with cognitive function and a lot of benefits. But if you are looking for something where you're trying to improve your nails, your hair, your skin, your tendons, your ligaments, then you definitely need a collagen supplement. But the added benefit is it also has some stuff in there that's for inflammation. So man, if you have musculoskeletal problems or skin problems, tendon problems, ligament, hair, this stuff is fantastic. The great thing I like about the whole company, Bioptimizers, is that they actually have a 365-day money-back guarantee. So if for some reason you don't like the product, it's just not working for you, you can contact the company. I don't know any company that has that type of guarantee. The confidence of this company behind their products is just awesome. So again, link down below if you want to try the collagen supplement that I like. This stuff is really awesome, so you got to try it and see the benefits to your own health.